the supplement that could ruin your medications. Before we begin, I want to make something very clear. This video is for educational purposes only. It is not personal medical advice. Always talk to your doctor, pharmacist, or mental health professional before taking any supplement, especially St. John's wort. Many people hear the word natural and think it must be safe. But that's not always true. Herbs like St. John's wort are biologically active. That means it can change the way your body works, affecting your liver, your brain, and even the way your prescription medications behave. In some cases, even small amounts can trigger serious and unexpected effects. So with that important safety note in place, let's now explore what St. John's wort actually is and why so many people turn to St. John's wort. What is St. John's wort? St. John's wort is a flowering plant used for centuries in traditional medicine to treat low mood, nerve pain, and mild depression. And modern studies suggest it may help some people with mild to moderate depression. However, the problem isn't its intended effect, it's how it interacts with your body's chemistry. So before we look at the risks, let's understand its main compounds. Even a small capsule of St. John's wort can trigger major changes in metabolism, especially in the liver and brain, potentially causing serious side effects. Understanding this interaction sets the stage for exploring its active ingredients. Active ingredients: hypericin and hyperforin. The two main compounds in St. John's wort are hypericin and hyperforin. Hyperforin activates liver enzymes, speeding up the metabolism of many medications, while hypericin contributes to mood effects and can increase skin sensitivity to sunlight. While these chemicals are natural, they act like prescription drugs, which can trigger unexpected side effects or dangerous interactions. With this understanding, it becomes clear why the liver's role is so critical. So next, let's explore how the liver processes medications and why St. John's wort can disrupt this delicate system. How the liver processes medications. Think of your liver as a chemical factory where specialized enzymes called cytochrome P450 process medications, hormones, and other substances at a safe pace. But St. John's wort acts like a hyperactive manager, forcing enzymes to work overtime. The result can be therapeutic shutdown, where medications are metabolized too quickly, or toxic buildup, where drug levels become unpredictable and dangerous. Now that we understand the liver's role, it's easier to see why certain medications can be completely canceled by this herb, which we'll cover next. Medications St. John's wort can cancel. St. John's wort can interfere with life-saving medications in dangerous ways. It can reduce or even cancel the effects of birth control pills, patches, and rings, raising the risk of unplanned pregnancy. It can weaken blood thinners like warfarin, increasing the chance of stroke or clot formation. It can block organ transplant drugs such as tacrolimus and cyclosporine, as well as HIV antivirals, risking organ rejection or treatment failure. It can also disrupt heart medications like digoxin, destabilizing heart function. These are not rare side effects, they are well-documented risks. Even a single capsule of St. John's wort can cause serious consequences. And with these dangers in mind, we also need to look at the opposite problem when this herb makes certain medications too strong, leading to life-threatening conditions such as serotonin syndrome, which we will discuss next. How St. John's wort can make medications toxic. Serotonin syndrome. While St. John's wort can reduce the effectiveness of some medications, it can also dangerously increase the effects of others by raising serotonin levels in the brain. When combined with antidepressants such as SSRIs like sertraline or fluoxetine, SNRIs like venlafaxine, or migraine drugs known as triptans, it can trigger a life-threatening condition called serotonin syndrome. Symptoms include agitation, confusion, rapid heart rate, high blood pressure, dilated pupils, muscle rigidity, and dangerously high fever. This risk highlights why professional medical guidance is absolutely essential. Now that we've seen how St. John's wort can make medications too strong, let's explore why this herb continues to be sold despite these dangers. Why it's still sold. Regulatory gaps. You might wonder why a potentially dangerous herb remains on store shelves. The answer lies in regulation. Herbal supplements are treated as food, not medicine, so they are not required to undergo the rigorous safety testing, clinical trials, or monitoring of interactions that prescription drugs face. This means the responsibility falls on consumers to understand the risks, which many people overlook while seeking a natural solution for mood or depression. Recognizing this gap helps explain why awareness and education are vital before taking any supplement. Having understood the regulatory issues, the next question is who is most at risk? Who is at risk? Not everyone experiences severe side effects, but certain groups are more vulnerable. People taking life-saving medications, women on hormonal birth control, organ transplant patients, those with heart conditions, and anyone on antidepressants or migraine medications face higher risks. Elderly adults or individuals on multiple prescriptions are also at risk, as the chance of dangerous interactions increases with each additional drug. Understanding who is at risk helps guide safer choices and emphasizes the importance of consulting healthcare professionals. Now that we know who is vulnerable, let's look at the warning signs that an interaction might already be happening. Signs you might be experiencing dangerous interactions. Watch carefully for warning signs if you're taking St. John's wort alongside other medications. Symptoms can include unusual bruising or bleeding, dizziness, rapid or irregular heartbeat, mood swings, stomach problems, unexplained fatigue, or serotonin-related effects such as agitation and dangerously high fever. If severe symptoms appear, immediate medical attention is critical. Recognizing these warning signs early can prevent serious harm and allow for timely intervention. Now that we've covered the risks and red flags, the next step is to explore safer alternatives and the importance of professional guidance. Safer alternatives in professional guidance. If you're looking for natural ways to support mild depression or improve your mood, there are safer options available. These include omega-3 fatty acids, regular exercise, therapy, and professionally monitored supplements. Always discuss these choices with a qualified healthcare provider and never combine herbal products with prescription medications without medical supervision. Seeking professional guidance helps prevent dangerous interactions while still supporting your mental well-being. With these safer options in mind, let's now recap the key takeaways about St. John's wort to strengthen your understanding. Recap: the dangerous truth. To recap, St. John's wort is a biologically active herb that can dangerously interact with many medications including birth control, blood thinners, heart medicines, organ transplant drugs, HIV antivirals, and antidepressants. It can even trigger a life-threatening condition called serotonin syndrome when combined with certain drugs. Because supplements are not strictly regulated, consumer awareness is essential. Understanding these key points empowers you to make informed choices and protect your health. Now that we've reviewed the main dangers, let's finish with some practical guidance on how to stay safe and take the right next steps. Your safety and well-being come first. Now that you know the hidden dangers of St. John's wort, share this information with someone you care about, consult your healthcare provider before taking any supplements, and stay informed about potential interactions. Subscribe to PharmaconHealth for more evidence-based guidance on medications, supplements, and mental health, and don't forget to hit the bell icon to get notified of future videos. Knowledge is your best protection, and taking action today can help prevent serious harm tomorrow. With that in mind, stay safe, stay informed, and always make your health your top priority. Thank you for watching. Stay informed, stay safe, and keep learning with PharmaconHealth tips.